Hello friends. Today we are going to discuss about cognitive behavioral therapy case formulation. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about how to draft a CBT case formulation, defining it, understanding it, what is the need for CBT case formulation, and what is the format of this formulation will be discussed. Now let's understand what is the meaning of CBT case formulation. First of all, formulation is a key skill and a tool in cognitive behavioral therapy. This was introduced by Beck himself. The Aaron Beck is the person who is considered to be the father of cognitive behavioral therapy. He's a psychiatrist. So he clearly said, the CBT case formulation aims to develop a shared understanding of the presenting problem. What is the reason for maintaining the symptoms? And what should be done in the therapy will be discussed. What do you mean by shared understanding? That means it is a collaborative approach by the therapist and the patient. Invariably, it is a hypothesis-driven framework used by the therapist to explain and to understand the patient's psychiatric problems and symptoms. This CBT case formulation integrates the theoretical model of cognition and behavior with a detailed client information to identify the factors causing the symptoms, maintaining or contributing to the patient's psychiatric symptoms. So what do you mean by then conceptualizing of the case? Conceptualizing means it is the process of understanding and interpreting the patient problem through the integration of assessment and information. That means here you're conceptualizing the case. You're not putting it to words. However, formulation is a subsequent and more focused phase that applies a theoretical model to describe the problem, their causes, and maintaining factors in order to direct a therapy effectively. So conceptualization is more of understanding the patient's symptoms, why they came, how they are maintained. Formulation is a subsequent putting it into words so that the therapist is able to plan and also convey the same thing to the patient. In other words, case formulation is the result of conceptualization. That means first the therapist need to conceptualize based upon the patient information. Here, the therapist considers 360-degree information about the patient life, about his childhood or his or her childhood experience. What do the patient thinks? Why do they behave in certain situation, in certain ways? Combines this information into a coherent story. That is conceptualizing. That means that is a story which is understood. Now somebody has to write the story. That is formulation. So let's enter into CBT case formulation. Formulating the clinical case is a process that allows the therapist to describe a patient's problems, identify the cause and factors that maintain the symptoms over time, and then design an effective therapeutic intervention so that the patient heals. This procedure is an operational tool that connects all the subjects, data or information, explain why the patient developed these symptoms, why they are maintaining, and also provides prediction about their behavior based on the triggering conditions. So, formulation is very essential, my dear friends. In simple words, once the patient provides information, the assessment is over, by that time, the therapist will be able to conceptualize the patient's origin of symptoms, their childhood, how the symptoms got originated, when they got precipitated, why they are maintained, and how it should be treated. So now let's look into the format of CBT formulation. This is how the 9 important headings for the format of CBT case formulation. First is the identification data, that is patient demographic details, presenting symptoms, that is psychotic symptoms, predisposing factors, precipitating factors, perpetuating factors, protective factors, prescribed intervention, planned implementing intervention, and finally, the flow chart which needs to be written so that anybody sees the case will be able to understand what the therapy and how the therapist was planned. So these are the 9 essential steps of the format of CBT case formulation. However, excluding the CABS model, the last one, it is considered as 8 P's model. 8 P's means 8 from patient data to planned intervention. It is starts from P. So you need to remember 8 P's. That is patient data, presenting symptoms, predisposing factors, precipitating factors, perpetuating factors, protective factors, prescribed intervention. What are those intervention was prescribed, and the planned intervention, how they are implemented. So all these 8 P's you need to remember and plan the CBT case formulation. Now let's look into the patient demographic details. Of course, name, gender, education, job, marital status, family background, socioeconomic background, rural urban background, all these gives you important information how the patient is born and brought up, under which background, what is his cognitive sophistication by knowing his educational status. So this gives you a rough idea who the patient is and what is his background, whether he is married, unmarried, all those will be essential. Moving to the second, presenting symptoms. Why the patient has come. In a chronological order, how the symptom started, when it started, and how it is increasing, worsening, decreasing, and you need to elaborate on each symptoms. Along with this, you look into the family history of similar symptoms were there, whether there is any past history of treatment, is there any comorbid medical conditions. For example, if a patient has hypothyroidism, that may be the reason which caused severe depression. So you need to look into the medical conditions, developmental history, personal history, and premorbid personality. So these presenting complaints should have a rough idea rather than a detailed assessment. So you need to say the patient presented with ABCD symptoms, starting A from 6 months, symptom B from 4 months, symptom C from 3 months, and EF from past 2 months. Family history of similar illnesses there. Past history of treatment with medication was given. He also has the diabetes mellitus as a medical condition. Developmentally, there is no any significant information or history available, or history is not there. Personal history of educated up to this much, married, premorbidly well adjusted. So this rough information should be given in presenting complaint. Moving to the third, predisposing factors. Predisposing factors are those which are historical in nature, biological, psychological, or a social characteristics of the patient that increases the vulnerability of developing an illness, particularly mental health illness. These factors precedes the onset of symptoms. That means they should be there before the onset of illness. That means predisposing factors are the fertile soil for development of an illness. So invariably, they should be present before the onset of symptom. So these factors precedes the onset of symptoms and contribute to the person's susceptibility, but do not directly cause the illness. That means They do not directly lead to the illness, but they are an encouraging factors. Like a fertile soil, the soil may not grow on its own. The plant seed has to be there, and a good environment and soil will help the seed to grow. Similarly, the soil is the predisposing factor here, my dear friends. Like genetic predisposition, a family history of mental illness is there, early childhood experiences like trauma, sexual abuse, personality traits like high neuroticism, externalizing behavior, low resilience, low frustration tolerance, increased impulsivity, and chronic medical condition. All these can be considered as a predisposing factors. Moving to the fourth, precipitating factors. Precipitating factors are recent events such as stressors, circumstances that directly triggers the onset of illness. These factors are often referred as a triggering and occurs close in time with the onset of symptoms. Example, the breakup of romantic relationship and the depression started within 1 or 2 days. Loss of job and immediately he started symptom. A financial stress, within 3 days he started having symptoms. Death of a loved one and suddenly he had a symptoms of depression, suicidal ideas. Traumatic incident, maybe a case against him. So various assault. So any acute change in the life and the onset of symptoms immediately can be considered as a precipitating factor or a triggering factor. Moving to the fifth, perpetuating factors. What do you mean by perpetuating? These are the factors or events, conditions and behavior or a thought patterns that maintain or worsen a mental health problem. Although it has been developed long back, these maintaining or perpetuating factors continues to keep the symptoms for longest period. That means it is considered as a maintaining factors. Neither it is a precipitating factor nor a predisposing factor, but it is a maintaining factor. The symptoms have already been started. There are some factors which helps them to continue to be there. They are called as perpetuating factors. For example, if a person has cognitive dysfunction, like he has a cognitive distortion, these cognitive dysfunction continues to maintain the symptoms. Maladaptive behaviors, drinking alcohol, not avoiding behavior, all these will continue to present symptoms. Unresolved conflicts, poor social support, ongoing family problems, chronic medical conditions can be considered as a perpetuating factors. Sixth one, what are the protective factors? Till now we discussed the negative factors. Now, what are those which is protecting him? The protective factors are those characteristics, conditions or resources that reduces the likelihood of developing an illness or else likelihood of negative mental health outcomes. It helps the individual to cope effectively with the difficult circumstances of life and stressors. Protective factors may be good social support, family support, excellent problem solving skills, healthy coping behavior, financial security, access to quality healthcare, sense of belonging to the community, stable and safe environment, good problem solving skills. All these can be considered as a protective factors. Moving to the seventh, prescribed intervention. What do you mean by prescribed intervention? Here in CBT, the various therapeutic strategies are planned and they have been prescribed. Here, the techniques, how to go about challenging the maladaptive thoughts, how to control his emotions, what are the behaviors which need to be changed. These interventions are prescribed by the therapist. Now, it can be cognitive intervention, it can be behavioral intervention, it can be skill-based intervention, or maybe it can be invariably family therapy, or various intervention can be prescribed by the therapist. Those prescribed factors we call it as. Now, there is a prescribed. Now, we need to plan the implementation strategy. That is called as planned intervention. Planned CBT intervention are concrete therapeutic techniques chosen based on the client's goals and specific nature of their difficulties. It is a collaborative between the therapist and the patient. Both of them will start choosing one intervention after the other. These are collaboratively selected by both the patient and the therapist, and each skill will be tested one by one. Example, initially they will think of starting behavioral activation over a period of 1 to 2 weeks. Later, they will choose activity scheduling, then cognitive restructuring, problem solving skills, relaxation skills, graded exposure. So, how the patient agrees and the therapist plan the intervention strategy, that is planned intervention. And finally, once you do all these things, we need to come up with a CABS model of flow chart. What is this CABS model? CABS model means cognition, A means affective, B means behavior, S means sensation symptoms. Let's look into each of them. The symptoms have been presented now. That means you're now drawing a flow chart based upon the conceptualizing the patient's symptoms, how they started, why they started, when they started, and why they are maintaining those symptoms or continues to be there. What is the intervention prescribed? What interventions have been planned one after the other? And finally, this CABS model is a part of formulation. So by looking at this flow chart, any other person will be able to understand and get the communication easily how the things are going. The patient presents with the symptoms and what are the childhood experiences, invariably traumatic experience, support and non-supported experiences, and then rules of living. Every person will have certain rules. I should not do this, I should get the first rank, I should be the number one, and if I don't get first, I should never do it. So those should, shall rules of living will be there. What are those? Cognitive schemas because of the childhood experiences, and then precipitating factor. He has all these predisposing factors. Now there is a precipitating factor. What was that precipitating factor? That needs to be documented. And finally, look into cognitive distortions, automatic negative thoughts, and what are the behaviors which are leading to mood symptoms, and also what are the affective symptoms along with depression. Does he have anxiety? Does he have frustration? Does he have jealousness? So all those affective symptoms, why they are present? Because of distortion and ANT, automatic negative thoughts. And finally, what are the physiological sensations? Headache, body ache, electric like sensation in the body. So all those physiological symptoms need to be considered, and each of them are related to one another. That is, cognitive, affective, behavior, and physiological symptoms, they are connected to each other, my dear friends. This is how the CABS model written, and finally we need to introduce a protective factors which has to be drawn. So if you look at the one of the CABS formulation flow chart, this is how it looks. Let's look at one after the other. First and the foremost is the significant early childhood experience, like lack of validation from the family or about the emotions, family emphasis on achievement and self-reliance, moving to the core beliefs. Core beliefs is like, I'm not a special person, my feelings are not important, I am useless, I am demanding and over emotional. So these kinds of core beliefs which is there. And further moving to what are the conditional assumptions and rules of living. I must achieve, I should do this, or I will be rejected. Either I am a hero or I am a zero. I must keep myself together, avoid losing control. I'll be nobody and everybody rejects me or criticizes. These kinds of rules are documented here. And what are the triggers? Failure in the exam, rejection by the family member, or rejection by the loved one, or a failure in romantic relationship. And what are automatic thoughts, especially negative, is that I am embarrassed, I am totally useless. Nobody loves me. I never been enough. I am not 100%. They are fed up with me. I will be never be loved. I will never be accepted. Those kind of automatic negative thoughts. What are the cognitive patterns? So here you will be looking into cognitive distortions and cognitive schemas. Cognitive distortions may be selective information processing, ruminations, self criticism, I am weak. Those kind of all cognitive patterns will be taken into consideration. Moving further, what are the behaviors? What are avoidance behavior? What are the behaviors which are maintaining symptoms? Whether there are compensatory caregiving, comforting eating, emotional outbursts, suicidal thoughts, suicidal behavior, looking at the emotions, whether there is a depression, anger, frustration, stressed out. So, those emotions, and finally, physiological symptoms like very anxious, poor sleep, decreased appetite, butterflies in the tummy, tearful, low energy, all these will be considered as a flow chart, my dear friend. By looking at this chart, you'll be able to understand how the CBT formulation is written. To conclude, my dear friends, CBT case formulation is a key skill which helps you to understand the patient and plan intervention. And further, to write this excellent case formulation, you should proceed through Socratic questioning, which guides the person to guided discovery, to know about his symptoms, what are his thought patterns, what are his distortion, what is automatic negative thoughts, and how the schemas are formed and how the symptoms are continued. This guided discovery also needs to be identified not only once, it has to be a repeated habitual pattern should be established by both the therapist and also the patient should accept. Once the patient is able to understand, he has this repeated thinking pattern which is coming in his way of life, then both the therapist and the patient need to work on it. The CBT format of case formulation is clear, which are 9 in headings. Invariably, first 8 are 8 P's, my dear friends. And this is how the case formulation is written, especially the flow chart. Start with the childhood experience, core belief, rules of living. What is this makes me vulnerable, predisposing factor, critical incidents, maintenance factor, and how CABS model, cognition, affective behavior, and physical sensations, my dear friend. So, this is about CBT case formulation. And if you are able to do a good case formulation, that means your therapy is going in the right direction and the patient is able to predict what is going to happen in the next few sessions, and you will be able to cooperate in the therapy. Thank you very much for giving your valuable time. Stay safe.